School is stressful as it is, with homework, projects, activities. Now imagine if your child is struggling academically, or if the teacher is calling you constantly to tell you about the behavioral issues that your child is having. It can be that much more overwhelming. On the next episode of Ask the Doc, no appointment required, I will help you navigate through this situation, help you find the support that you need, and answer your questions and more. On this next episode of Ask the Doc, no appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, I'm Dr. Scarlet Constant, board-certified pediatrician and founder of Constant Care Pediatrics here in Miami, Florida. On this episode of Ask the Doc, I'm going to answer your questions about academic difficulties and navigating through the school system and getting the support that you need for your child that may or may not be struggling. Send in your questions and I will answer them for you in real time. It looks like we have a question coming in right now via email, and this question is from Elise. My son is very active, and his teacher says he may have ADHD. I was shocked, but the teacher said it's very common nowadays. How do I know if he has ADHD? Is it as common as his teacher said? Well, Elise, ADHD, first of all, it stands for Attention Deficit Hyperactivity Disorder, and there is a criteria that we can use to diagnose your child. But before I get into it, let's take a look at this video from the Mayo Clinic that'll tell us a little bit about ADHD. So as explained in the video, there are many facets of ADHD. You have the impulsive component, inattentive component, hyperactivity, and you don't necessarily have to have all three to be diagnosed with ADHD. Therefore, yes, there are definitely more children diagnosed with ADHD, but it is also because it is a much wider umbrella than it had been in the past. And to answer your question about your son, the way you would diagnose him is you could bring your son to your pediatrician, or to his pediatrician, excuse me, and we use a criteria. Usually there's a Vanderbilt questionnaire form that we have you parents fill out, and we also give it to one or two teachers at school to answer a couple of objective questions about your child. And these questions really help us like streamline and figure out if your child truly has any of these components and in fact does have ADHD. You can also bring your child to a neurologist. Neurologists will also diagnose ADHD, as well as psychologists. The reason why psychologists are sometimes a little more beneficial than going to your pediatrician is because a psychologist would actually administer an educational assessment. So not only are they looking for or diagnosing ADHD, they're also testing for other learning disabilities, which could be very beneficial depending on the concerns that you have for your child. So as I mentioned, your child could be diagnosed by the pediatrician, the neurologist, or the psychologist. And I don't know enough about your child yet to tell you if he has ADHD, but certainly he does have some of the symptoms that are encompassed in the bracket of ADHD. I hope that helps. Okay, it looks like we have another question coming in, and this question is from Jeremiah. My son never had a problem in school, but lately I see him struggling, especially in the last semester, and his grades have been slipping. I don't know if he's just not interested or if there's something else. What can I do to help and support him? Well, I'm really happy that you are noticing these changes in your son, and it's important that once you see these red flags, you address them right away. So congratulations to really being in tune with your son's symptoms and what he needs. You know, there are many reasons for slipping grades in school, and I don't know how old your son is or what grade he's in, but you know, it changes with each age group. And I will say in general, the first thing you want to do is have an open conversation with your son about his social structure, about his friends, and really you don't want to interrogate or interview him, but just in an open-ended casual discussion, just see what's going on in his social circle, make sure that things are still status quo. Sometimes it could just be something as simple as a fight with a friend or falling out with a very close friend. You also want to know if things are okay at school, in the classroom. Of course, you want to make sure your child's not feeling ostracized or left out or stressed out. So overall, what you're looking for are exogenous stressors in your child's life that might be leading to his grades slipping. So you want to know what's happening in school. Is there a teacher maybe that he doesn't like or that he is not getting along with that is stressing him out? You also want to, take a look and see if the grades are slipping across the board or in one subject in particular, because that's very telling. If it's across the board, we know that it's a general problem that's happening, whereas if it's a particular class, maybe he just struggles with that subject in particular. So you want to look at all of those things. Of course, it's always important to look within. Make sure that there aren't any major changes in your home. Maybe there have been some changes or some stressors that you might have overlooked, or you just didn't really think affected your child so obviously, and maybe it affects them in a different way. So look within, make sure at home everything is okay, you don't have any stressors in the home. And then once you've ruled out any type of exogenous stressor that's going on, now you can delve in and see, is this really like a learning disability, or are we having a learning block with a subject in particular? Is it perhaps, the material that is maybe above and beyond what your child can handle, or vice versa? So at that point, you'd want to schedule a meeting with your child's teacher and just see what they say. Have they noticed the slipping grades? Do they see a change in your child? Do they see a change in behavior versus a change in the way they're taking their test or turning in assignments? There's so much to do there. So I would first investigate at home, speak to your child, have an open-ended conversation. And then if we've ruled out anything social, emotional, then we jump in and start talking to the teachers or counselors or even principal if that's necessary, and have them help you and guide you so that you can get the support that your child may or may not need. I hope that was helpful, and good luck with your son. Looks like we have another question coming in, and this is from Angela. My 9-year-old came home and talked about his friend and classmate. He said the boy is a nice kid, but bragged about not going to sleep until very late, only taking a shower a few times a week, etc. How important are these daily habits in a child's academics and ability to learn? Well, Angela, sleep hygiene is very important. And let me start with just structure in general. It is very important for children to have structure at home. And I do feel that there is a generation of parents that maybe were really constricted by structure and routine, not routine, but structure and basically strict rules at home. And then as they grew up and had kids, they felt that maybe they should relax a little bit and loosen the ropes, because they have their own trauma from how strict things were when they were young, but that can also backfire on you because as a result, you become a little too relaxed. And not having structure for a child is actually detrimental. While they may love it and it feels like you get to do whatever you want, and my mom is not stressing me out, having that lack of structure, it affects you in many different ways. So for example, you're going to school late because you slept late and you didn't get enough sleep, and you're missing the beginning of a class, or you didn't get to have breakfast because you were running out the door, or maybe you don't want to eat breakfast and your parents tell you that's fine, but then you're starving before lunch at school, and then it's hard to learn because you're hungry and you're tired. I mean, it's a domino effect. So we have structure in place and we have things for our children because we know that this is what you need in order to get through a full day, energetic and awake and alert and ready to learn. So let's talk about sleep hygiene. It is very important for children to get anywhere from 8 to 10 hours of sleep a night. Your body is still developing. These children are still going through puberty or haven't even gone through puberty yet. Their brain is growing. They need sleep. They need their neurons to fire, to synapse and store memories and basically solidify anything that was learned during the day. The body is actually growing. This is what we need before we start another day of school. In the morning, you need a healthy, protein-rich breakfast, and you need good fat for your brain. Your brain needs energy. And this is how you're able to have the energy and alertness and attentivity to learn and pick up things at school. Sometimes parents or some teachers might complain about a child being hyperactive or inattentive. The inattentivity could truly just be due to lack of sleep. The inattentivity could be due to hunger or maybe a crash from having just a sugary breakfast that wasn't nutritious, and then by the time they get to class, they crash and they kind of seem out of it and loopy and inattentive, and they're incorrectly called ADHD or suspect ADHD when really it's just, poor sleep hygiene or maybe a bad breakfast or just not really having a good routine before school. So let your son know that while this friend of his is having a blast and doing whatever he wants, it really is not an ideal situation. Okay, if you want to send in some questions, we still have time. Take a look at this promo to see how.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, well, these questions are great, and it looks like they keep coming in. Here's a question that we have from Raleigh. My friend and I were speaking the other day, and she mentioned that she has an IEP for her daughter, who struggles some at school. My son struggles as well. What exactly is an IEP? What is it for? And how do I find out if my son would be eligible? Well, an IEP is an acronym for an individualized educational plan. And your school will come up with this plan and actually design it specifically for your child after they've evaluated your child for learning difficulties or academic difficulties at school. So after they've evaluated your child and they've actually figured out exactly where the deficiencies are or what support your child needs in order to thrive or to improve in school, they will create this individualized educational plan to cater to your child in order to support them. And they will put this in place in the beginning of the year, and they will keep it each year that your child needs it. Sometimes some schools might encourage you to see your pediatrician and get a formal diagnosis in order for you to go back and ask for the IEP. But the reality is, specifically in the public school system, in the Broward County and Miami-Dade County school system, the schools are required to evaluate your child who is struggling and who has had difficulties at school. You've had meetings about this and you've raised the concern. They would evaluate your child, and then based on the results of the evaluation, they will help design this individualized educational plan to put in place for your child. So I encourage you to call your child's teacher and schedule a meeting right away if you do have concerns for your son. Okay, we have some more questions coming in. Our next question is from Artie. This is an email that came in. My son fell asleep in my room the other night, and I noticed he was snoring really bad and almost sounded like he had trouble breathing. I've noticed his grades have been slipping, and now I'm wondering if he has sleep apnea, and if so, if that is causing his problems in school. Am I off base, or is there a relationship between bad sleep and bad grades? No, Artie, you're not off base. There is absolutely a relationship with poor sleep and bad grades. Children that suffer from sleep apnea are not getting full uninterrupted sleep through the night. They are exhausted in the morning, they are tired of school, they fall asleep in class, and they demonstrate characteristics of ADHD. They tend to be hyperactive, they are inattentive, they are impulsive at times, and this is a direct result of the poor sleep that they have due to the sleep apnea. Now, if your son is snoring and you are concerned that your son is actually apneic, meaning he stops breathing periodically through the night, then you would need to see your pediatrician, or your son's pediatrician, excuse me, and discuss this with the pediatrician. Likely your pediatrician will refer your son to an ear, nose, and throat doctor, an otolaryngologist, and they will evaluate your son's septum and adenoids and make sure that there isn't anything obstructing or causing the apnea. Then they would suggest a sleep study, which is a study where your child is monitored while he's sleeping, and they're recording his breathing to see if he has true apneic episodes, meaning he actually stops breathing periodically through the night. If it is discovered or diagnosed that your son does in fact have sleep apnea, the proper treatment would be put in place, and actually once that is managed, your son's grades should start improving if that was the sole culprit of his bad grades. So I do encourage you to bring your son to his pediatrician. Okay, we have an email coming in with another question, and this question is from Eleanor. Hi, Dr. Constant. You talked earlier about kids and ADHD. Can you talk a little bit about the pros and cons of taking ADHD meds? Can kids get addicted to these medications? Eleanor, that's a great question. You know, the medications have been a very controversial topic. I know that most parents do not want to medicate their children, and I totally understand why you wouldn't want to. There are ways to manage ADHD without medication, absolutely. And again, it depends on what form of ADHD your child has. There could, some children are impulsive, and it's very difficult for them to control that. Some have behavioral problems that are just not managed well at school, and some just have problems focusing or reading during reading or long tests or long passages. So depending on the type of ADHD your child has and how responsive they are to non-pharmacologic treatment, you could actually manage the ADHD without medication. Now, the medication that is gold standard for ADHD management are stimulant medications, or stimulant and non-stimulant. And, the pros are you will see a difference in your child's ability to focus and concentrate. And a lot of times you'll get positive feedback from the school reporting that your child's behavior is so much better. Sometimes the grades improve, not always. And you will see that your child is basically a little more calm than you might be used to seeing them. So that's a pro. Now, the cons are, it is a stimulant. Medications do cause a lot of side effects: abdominal pain, headache, lack of appetite is the most common. Many of these children do not eat during the day, and they usually will eat once the medication wears off. So, it's very difficult when you find that the child has a very low appetite. They skip meals. Sometimes it does affect, especially the adolescents, it affects their mood a bit, for better or worse. And in certain cases may even cause increase in aggression. So these are things that you want to go over with your physician and decide which medication would be best for your child, depending on the side effect profile, and also just depending on the type of ADHD your child has. So there are many benefits to the medications, and again, it just depends how severe your child is and what it is we are trying to improve. I just want to remind the viewers that ADHD medication does not directly improve grades. And I know that sounds silly to mention, but I think that sometimes parents are misinformed or maybe misled to believe that their child's grades are slipping because they have ADHD. Therefore, if they're treated for the ADHD with medication, the grades will then inevitably go up. And that is not necessarily the truth. Remember, there are many reasons for slipping grades. There could be an underlying learning disability in addition to the ADHD, or you could be inattentive or have lack of focus because you have a learning disability. If it's difficult for you to read, it's difficult for you to focus on what is put in front of you. Maybe sometimes you just you're bored in class, or you don't want to do the work because you find it difficult. So there are learning disabilities that you want to make sure you rule out for your child before you even consider getting on a stimulant medication. Because if they're on medication, they can focus much better, they're quieter, they can read, but if you have a learning disability, that's not going to fix your learning disability. So we need to make sure we address all of the problems that are in play and then decide whether or not medication is actually necessary. So I hope that answered your question. Looks like we have another question coming in. This is from Shanna. My son has been struggling in school. I had a meeting with his guidance counselor, and he suggested getting my son evaluated, but didn't go more into detail. Who should I take him to? A psychologist? A neurologist? This is all new to me, and I don't know what to do next. Well, Shanna, that's a great question. And as I mentioned before, there are many ways to go about this, and it depends on where you live, what accessibility you have, but I would always suggest going to your pediatrician first. All of us in pediatrics were trained in academics and ADHD, learning disabilities, behavioral disorders. We know how to manage it. We know how to diagnose it. We know how to screen for it. So I would first start with your pediatrician. Have a long talk with them, an honest talk with them, and let them know what's going on at school and have them help guide you, whether it's diagnosing in the office or guiding you to the right specialist that will be able to give a diagnosis. It is important to see your pediatrician first. Now, as I mentioned before, psychology is great because they can do an overall academic or educational assessment. And that's really great because it will screen for learning disabilities. It would actually tell you if your child is gifted or not gifted. It would tell you where your child is weak, where they're strong, if, reading and writing versus math. It gives you a lot of insight into your child's capabilities and the type of learner your child is. And at the same time, it would be able to diagnose or rule out ADHD. And then finally, a neurologist is also a good option. It's very difficult to get an appointment with a neurologist. And if it's really just because you have a suspicion about ADHD, I suggest that you first try to go see your pediatrician. But yes, neurologists are great at assessing academic difficulties and ADHD and actually diagnosing and managing the treatment if needed. Okay, if you want, we have some time left, so if you want to send in your questions, take a look at this promo to see how to do it.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, welcome back. So we have a couple more questions that are coming in. Look at this. We have a question here from Adriana. My 9-year-old is brilliant. I know a lot of parents say that about their children, but as a mother of 3 kids, I can see a real difference in my youngest child. He does well in school, but he complains about being bored by the work. He does it, but it's not challenging to him. Should I get him tested to see if he should skip a grade or go into gifted classes? Well, that's great, Adriana. Congratulations that you have this brilliant child. I think that's wonderful. I think it's very difficult when kids come home and say they're bored at school. A lot of parents feel that if their child is very smart, then school is, just not keeping up with their child. And, at this young age, what I can say universally is that there is nothing that there's no way that a 9-year-old knows everything in 4th grade, right? So there are plenty of things that he still can learn. Maybe the way the material is presented to him is a little boring. He's probably a fast learner. He's, probably very intelligent and can take in the material, process it a lot faster than his classmates. And that poses a problem, of course. But I don't think that necessarily means he needs to skip a whole grade. I think that you need to have a conversation with his teacher about how we can, stimulate him in class, present the material in a different way, or actually complete assignments in a different way that would be more stimulating to him rather than the brick and mortar that he possibly is experiencing in class. So I think that's a conversation you should have with the teacher. Of course, testing for gifted is always helpful because depending on the school, the gifted classes are structured in a different manner that might help move things along at a faster pace for kids like him. So definitely testing for gifted, but I would start by having a conversation with the teacher so the two of you can work together and figure out what is going to work best for your child in class. So it looks like we have another question, and this is from Steven. My son is 6 years old, and my challenge with him is his food choices. How can I get him to eat healthier, and what can I serve him that's healthy but also tastes good? Well, that's always a challenge, Stephen. Yes, I know. I wouldn't be so concerned about the healthy eating. I would just make sure you give a couple of good choices that he can choose from that are not junk food. But I think as parents, we get really, really, we start to concentrate on vegetables and having major food groups, and we want this perfect plate, and that's very unrealistic. Just try to get 2 or 3 good things, a protein, a good fat, and a veggie on the plate, and have him explore, and he will overall develop and start changing his palate. That's all we have time for today. Thanks for joining.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.